So today I wanted to take some time to speak a little bit about moral distress, especially given a couple situations that I've had with my students over the last few weeks. Now, for those who aren't familiar with the term, moral distress comes to us from the 1980s nursing literature, where it was noted that nurses have this undesirable psychological emotional reaction when they're not able to do what they see as morally correct. Now, this might be that there are two equally correct things that you want to do, but you can only do one. So there's two equally sick patients and you have to prioritize one of them because there's only one of you. Or it might be that there's something that you want to do that you see as correct, but something external is preventing you from doing it. So a hospital policy, resource constraints, some sort of legislation from the government, for example. Now, moral distress is everywhere in medicine, in healthcare. All of us experience it, all of us feel it. Even for trainees, moral distress is described as inevitable and as part of the training. So I think one of the tricks is not to avoid moral distress, right? Because feeling and witnessing and experiencing reactions to the things we deal with on a daily basis, that makes us human, right? That means that we care. And it's not a bad thing, but it's important to recognize moral distress when it occurs so that we can act on it, right? And especially for my more junior learners, I usually recommend debriefing with somebody, discussing with somebody. And that might be a peer, that might be a mentor, that might be your preceptor, your supervisor if you feel comfortable. But it's really important to try and lend words to these emotions and speak about the things that we're witnessing. As you go through your training and as you go through your career and you become more experienced, you might find other ways to manage moral distress. A lot of people will use reflective writing or journaling. A lot of people will still debrief with others, and that's why it's important. You'll hear a lot about building your support team, your support network, especially people who understand healthcare or understand the medical field, and you can have a back and forth with about some of the troubling things that we witness or we experience on a day-to-day basis. It's also important to be kind to yourself and make time for yourself, make time for activities and things that are restoring, because that can also help sort of balance out, I guess, some of the distress and some of the difficulties that we see. Finally, when we're talking about moral distress, it's also important to pay attention to the things that we can do, and the ways that we can help people. Sometimes it's easy to get caught up on the things that we can't do, but especially if these are things out of our control. Again, going back to resource constraints, or going back often if you're short-staffed and everybody is not getting timely care, for example, as long as you're doing the best that you can, right? You have to make sure that you're giving yourself grace and space, and recognizing the impact that these sorts of situations can have on you, on all of us, so that you can move forward.